Hi everyone, today let's talk about rheumatic heart disease. This is a condition where the heart valves have been permanently damaged by rheumatic fever. Basically, heart has four valves which open and close to make sure blood flows in correct direction, which includes aortic valve, mitral valve, pulmonary valve and tricuspid valve. Here, permanent valve damage happens following rheumatic fever. And what is rheumatic fever? It is an autoimmune inflammatory reaction to strep infection caused by group A streptococci. Here, the autoimmune inflammatory reaction means our own antibodies get directed against our own cells cause inflammation. This fever or inflammatory disease that can involve heart, joints, skin, and brain typically develops 2 to 4 weeks after a strep infection. Strep infection means the infection caused by group A streptococci. Just an example is strep throat and scarlet fever. For more understanding, just imagine a person is getting strep infection. In some cases, after 2 to 4 weeks, an autoimmune response activated and causing inflammation, which is called rheumatic fever. Here, the heart valve inflammation happens. Although the infection or fever is completely cured, ongoing valve damage occurs and leads to permanent valve damage known as RHD. Then, what causes RHD or rheumatic heart disease? Heart valve inflammation from rheumatic fever causes RHD. The damage may happen right away or it can develop over time from repeated strep infection. Continuing inflammation leads to heart valve scarring and narrowing. Later on, it will lead to heart failure. Let's see the signs and symptoms of RHD. Some people may have symptoms of heart involvement during an acute episode of rheumatic fever, but most cases the signs and symptoms may appear or develop years after the infection and fever are gone. Symptoms include shortness of breath with exercise or at rest or when lying flat, chest pain, fatigue, palpitations, cardiac arrhythmias like atrial flutter or atrial fibrillation, persistent cough, swollen ankles or feet. This edema we can see in later stages of RHD. Then unexplained weight gain due to fluid buildup and decreased exercise tolerance. Additionally, you may have common symptoms of rheumatic fever. And do you know RHD isn't contagious but strep throat is. And there is no cure for RHD if the damage to the heart valves is permanent. Let's see the types of RHD. It can categorize the way the disease affects the heart valves. Valvular stenosis and valvular regurgitation. Valvular stenosis occurs when the opening of a heart valve narrows due to scarring. It can further divided into mitral stenosis, aortic stenosis, tricuspid stenosis, and pulmonic stenosis. If we are saying about mitral stenosis, the mitral valve located between the left atrium and left ventricle struggles to open fully and hindering blood flow from left atrium to ventricle. Next is valvular regurgitation. Regurgitation means backward movement or backflow. This happens when the valve leaflets do not close properly, causing blood to leak backward. For example, in mitral regurgitation, blood leaks back from left ventricle to left atrium. Not only mitral regurgitation, it also includes aortic regurgitation, tricuspid regurgitation, and pulmonic regurgitation. In some cases, both stenosis and regurgitation can affect the same valve, causing a more complex issue. This is known as combined stenosis and regurgitation. Next is diagnostic measures and tests. Medical history and physical examination. Here you can ask for past strep throat infection and current symptoms. In physical examination, you can auscultate for abnormal heart sounds like murmur, which indicating valve malfunction. Blood test, ASO test, anti-streptolysin O test. This helps to detect antibodies produced by the body in response to strep infection, but it doesn't confirm RHD. Also, CPR test, elevated CPR levels to measure inflammation. Chest X-ray, you can check for enlarged heart and echocardiogram. Here, this is a gold standard for diagnosing RHD. Can detect heart valve problems. Then ECG to check abnormal electrical activity and cardiac MRI. Let's see the management and treatment of RHD. Long-term antibiotics like penicillin are often prescribed to prevent recurrent strep infection and subsequent RHD. It is very important to treat strep infection and rheumatic fever along with RHD. anticoagulants or blood thinners to prevent blood clots that could form on damaged valves. Then, beta blockers and antiarrhythmics might be used to regulate irregular heartbeat caused by RHD. Anti-inflammatory medications like aspirin or corticosteroids may be used to reduce inflammation in heart valves. This is all about the medication. Next is minimally invasive procedures like balloon valvuloplasty. Here, a catheter with a balloon is inserted into the heart to open the narrowed valve. Mainly, it's using for mitral stenosis. Let's come to the surgery valve repair. Here, a surgeon repairs the damaged valve to restore its proper function. Then, valve replacement, in which the surgeon replaces the damaged valve with a mechanical or biological prosthetic valve. Let's see the complications of RST: arrhythmia, abnormal heart rhythm, heart failure, pulmonary hypertension, stroke due to clot formation, and infective endocarditis, an infection in heart valves. If this video really helps you, please like, share, and subscribe my channel. Enjoy your studies and take care.